Hi, and welcome to In Real Life with me, Pete Carter, and Sasha Caridia, my great friend. And here we are with our Christmas jumpers on, Sasha.
Yes, slightly jingly, elf-like, I think, today.
Definitely elf-like. Mine not. Mine. I'll demonstrate. Polar bear, blue, correct colour, blue. Sasha, more red. Red, blue and red, but that's the in-jokes, the football jokes. We won't go there too quickly. So we thought we'd have a chat around Christmas time. We're hoping that you'll enjoy your Christmas celebrations, but just recognising actually with Sasha and I, both of us with many years of working in those services, me obviously the medical world. Sasha, you've been in some other worlds as well as the medical world, haven't you?
Yeah, I started off life as a police officer and then went to the ambulance service and now I work in hospitals. So experienced Christmas in all its various shapes and forms in our lives.
And saying like most healthcare workers, actually Christmas is not just a time off and resting, is it? It's actually very much a work time, and we just wanted to acknowledge that for all of you out there who are watching this, healthcare workers. Just thanks for all the Christmas work that you do, and maybe some of you will be doing that again this year. And we've got some stories to tell about that, but just want to acknowledge that I've heard a phrase used a few times actually online on broadcast, which is very true. It says no, the virus won't stop for Christmas, and I thought no, but actually they never have. Viruses have never stopped for Christmas. Illnesses haven't, and healthcare doesn't stop for Christmas either, does it?
Yeah, I mean, similarly, we on the Thursdays early on in the pandemic, it was the clapping on a Thursday, and there was another phrase that came in on Thursdays: the clapping stopped, but we didn't. And I think that sense as well, that we just keep on going, and Christmas is a fantastic example of that. And I think in terms of sometimes sacrifice of that, and yes, it's an interesting time to work.
Yeah, it is. There can be sacrifice involved. I remember my first year qualified as a doctor, and junior hospital doctors who worked the crazy hours those years. And when we hit a weekend, used to work 80 hours non-stop. And Christmas that year happened to come on a Saturday, and it happened to be my weekend on. So I started at 9 o'clock Friday morning and worked through till 9 a.m. Monday morning. Fortunately, had the Monday off, which was unusual. So I worked a 72-hour shift over Christmas, and I thought, wow, actually, yeah. And there the whole time. Now, it was obviously a sacrifice for me and my family, but in many ways a privilege to help the people who actually needed to be in hospitals and be around the staff who were providing the care. So yeah, it's a mixture, isn't it?
No, definitely. There's that sense of from the patient point of view and being there for the patients, but then also your colleagues as well. And sometimes the decisions we make with regards to if we're going to work Christmas or not. I mean, in the different places that I've worked, it's been done in different ways. You're either rotated to work, or your names drawn out of a hat, or you get to choose. But I mean, certainly for myself, one of the things that I decided to do fairly early on, I was 19 when I started doing all this sort of stuff, was that I had colleagues who had been working in the police, the ambulance, and hospitals for a long number of years. They have families, and I have kids, and the decisions that you make regards to whether you work Christmas or not. Yeah, and the other thing I was thinking around that is, and we were talking about healthcare workers, but actually then the healthcare worker has a family somewhere along the line, and actually the working or not working over the Christmas period also affects the family of healthcare workers or those working in the public services. It's a bigger picture type thing.
Yeah, and also you don't get a long break, even if you've got Christmas Day off. You might be working Boxing Day. If you've got Christmas and Boxing Day, most people are back in on the day after Boxing Day. No, in general practice that was true. The staff, the receptionist, and all that. So it was actually a lot of people look for that long break between Christmas, New Year, having the whole time off, which I thoroughly understand is a nice break, but actually is not a reality for most healthcare workers. And we don't say that, but then I don't say that grudgingly. I think it's worth just acknowledging that's a reality, so that when people are approaching Christmas, and particularly this Christmas time when there's a lot of pressure upon the National Health Service, just taking that into account. And so number one, we're going to celebrate all of you who have worked over Christmases, will work over Christmases and the New Year. And So well done, and thank you for being heroes. And we understand what it's like, Sasha and I. But so I'm not working medically this Christmas. How about you, Sasha? You got anything?
Well, I actually have a Friday is my contracted day off, and Christmas Day falls on a Friday, so perfect timing.
Oh, there we go. There you go. Now, you're going to tell us about some Brussels sprout stories, because I don't like Brussels sprouts. That's a definite. But you do, don't you, Sasha?
Yeah, I've got a bit of a quandary at the moment. Okay, let me confess, I love Brussels sprouts. I believe they're not just for Christmas. I believe they're for life. And no, I'm a bit of a quandary at the moment because, well, one of the things I'm doing with my family is we put together our Amazon wish lists, and we sent the wish lists to each other. So I sent my wish list to my relatives. The idea being that we then buy the presents for the person who's got their list, and we send it to their home address. So my presents are currently sitting all wrapped up, and I'll then be able to take them with me to my parents, because that's where I'm going to celebrate Christmas. With our plans, it was done in a way that, things might have changed. We might not have been able to be together. My sister and brother-in-law will be on Zoom with them, and we'll open our presents together. Now, my quandary is, it might just be that Father Christmas might have sent me some death by chocolate Brussels sprouts. Mm. I know. The problem is I can't find them. And I'm not entirely sure.
Well, you or somebody else?
Pardon?
Is this a present for you or a present for somebody else?
No, it's for me. It's for me. And I'm now imagining that maybe come mid-January I'll open a cupboard or a drawer somewhere, and there they'll be. So that's a quandary I have. But no, yes, Brussels sprouts. Chocolate Brussels sprouts. What more can be said? I don't know what you feel about Brussels sprouts, Pete.
Well, yes, I don't like them basically. So chocolate Brussels sprouts. I'm not talking about Brussels sprouts coated in chocolate. That would be very weird. But I mean actual chocolate. One that made to look like a Brussels sprout. Okay. Usually the chocolate's not very good, but no, I remember that. It always did confuse me. I don't like Brussels sprouts. A lot of people don't. I think they probably have genetically engineered them to be a bit less bitter and stuff. But certainly when I was growing up, thinking, why am I eating these things? I don't like them. And I wasn't forced to eat them throughout the year. They came out on Christmas Day. And it really used to confuse me as a little boy. Why I never ate these things I didn't like all year. But then on this special day, Christmas Day, when it was a special dinner and everybody was very, big preparation, I ended up with these, and it was very precise, 4 Brussels sprouts on my plate. 4. I had to eat 4. I don't know why, but it was 4 was the required amount. And I remember actually, so Christmas meals, rather than remembering the turkey, Brussels sprouts, I've got to eat 4 Brussels sprouts again. So I think when I was 14, I suddenly caught on. I said to my mum, I said, why am I eating Brussels sprouts? She said, because it's Christmas. I said, I don't like them. I don't eat them the rest of the year. Why am I forced to eat these on Christmas Day? And then she realised, okay. So I got out of it then, and I do try them out every now and then, but I still don't like them.
Well, it's the Christmas meal thing, actually. If you're asking about stories and things that we've got of working around Christmas, probably is one of my favourite, funniest memories of working Christmas. So at the time this happened, I was living in what you might call a Christian community, about 15 or 16 of us, and they knew of my passion for Brussels sprouts. And so I was working on Christmas Day, and when I came home, I would have a Christmas dinner waiting for, which I thought was beautiful. At the time, I was working in the London ambulance service, and every ambulance station had the potential to have a bit of a Christmas dinner going on, and also every hospital. By the time I'd finished my shift, I had had 3 Christmas dinners.
Wow. Because
I like sprouts, I had gone heavy on the sprouts. Because the folk that I lived with loved me and knew my passion for sprouts. And luckily, I think actually they didn't like them. When I got home, my plate was a thing to behold. And there's a bit of turkey, but it was this mountain of sprouts. And I walked through the door, and I kind of said, "Hi guys, happy Christmas." Sat down, and this plate was presented to me. And if anyone has seen the Vicar of Dibley episode of Christmas, that was what was going on. And because I love them, I kind of wanted to, I love sprouts, but the people I was living with wanted to say thank you. It was horrific. Well, that was pretty difficult. The next day was something else. I will leave it to your imagination.
Yes,
that for me is one of the treasured memories of Christmas, working Christmas, and
a Vicar of Dibley moment. A Vicar of Dibley moment.
oh,
I'm trying to think back to that weekend I worked in my first year as qualified as a doctor, is how much chocolate I ate, because it was absolutely everywhere on the walls. There people, and actually I remember actually the patients expressing their gratitude, and this is one thing that reminds me of Christmas, actually, how much gratitude is expressed, expressed and is expressed, I'm sure, towards other people. But I used to get so much gratitude expressed towards me at Christmas from my patients, and just something that very easy to take for granted. And all sorts of presents. But I remember that first Christmas, actually, I got given 2 bottles of whiskey. But actually, at that time in life, I didn't like whiskey. I wasn't my drink, so I had no idea what to do with these. But just outside the hospital was an off license. So after Christmas, I hopped round to this off license, taking these 2 bottles of whiskey. I said, I'm a doctor in the local hospital here. Got given these 2. Can I swap them? And the off license did me a swap for the bottles of whiskey for something else. I think they probably got a good deal out of it, and I got something that I'd like to drink. But yeah. So yeah, that helps me remember that sort of the gratitude that is expressed towards us, broadly speaking, particularly over the festive period, and it's worth remembering all that.
yeah, I think it's a really good point, and I think actually we can sometimes skip over the thank yous. And I think it does us good sometimes just to actually take the thank you, the gratitude on board, and actually receive it. Because a lot of times, oh no, I would be here. No, actually, because actually, in actually taking that thankfulness and the gratitude on board, you're honouring the person that's offered that to you as well. And then this sort of mutual sort of conversation can grow out of that. But I think it does you good to actually take note of what people are saying. It's not just a throwaway, oh, thank you, I think it's a common shared experience. If a patient is in hospital at that time, there's that sense of, well, I'm here, and gosh, you're here, and thank you so much.
Yeah, I think it is. And then people that you've interacted with the year in a very meaningful way, actually come back and say thank you. So one of the ones that you stick in my memory, has stuck obviously forever, effectively, was again, it was my first year in general practice, and I actually basically diagnosed a baby who was just a few days old, who was thought to just have sniffles and a bit of a runny nose, but I got the baby was brought to see me, and I soon realised that, and this was fortunate because I've worked in a paediatric cardiology unit. I realised this actually child was in heart failure, which is pretty unusual for a child a few days old, and I was able to diagnose that without all the specifics, and got this baby admitted to hospital as an emergency, and it actually underwent emergency cardiac surgery, which saved its life, and it's her life actually, little girl. Every year I used to get Christmas card from these parents with a little update on how that life was developing, and they would just thank me, and until probably went on for about the 7 years that I was actually in that practice, every year. And thought, well, again, just beautiful moment where actually saying thank you, and this is what's happened in the life of our daughter in this last year. Yeah. Those are very precious moments, aren't they?
Yeah, it's very powerful, very, very powerful. Their Christmases would never be the same after that. You would actually probably, in their memories, would form part of that every time that they celebrate Christmas, another year. It's very, very powerful. I think the influence that we can have in people's lives that we wouldn't even necessarily be aware of. I'm sure, I can't think of specifics, but I'm sure there are things that have been said that we may have said that we get to our interactions with people at particular times of year, and Christmas is more of a polarizing time of year, isn't it, for many reasons, that we won't know necessarily that what we said or did had such a major impact. I think it's worth bearing that in mind, actually, isn't it? That and again, it probably feeds into the fact that we're not doing this alone. We're literally walking with Emmanuel. And that's what the whole thing is, isn't it? It's God with us, and we're literally walking into every situation with God with us. And if we have an ear to heaven, if we have an ear to His heart in that moment, we get to sow something into someone's life that we may not be aware of, and that's powerful. That's really powerful.
Yeah, I look back on that specific story because obviously I had very specific experience in paediatric cardiology and cardiac surgery, which a lot of GPs wouldn't have. They'd have paediatrics, but it wasn't necessarily easy to recognise and diagnose. And I was just no, it's not making me out special. You know, everybody has different experience, but I thought I happened to be the one who was in the surgery when the health visitor called, said, "Would you have a look at this baby?" And I said, "Oh yeah, sure I would." It happened to be me.
Yeah.
You know, I thought, God loves people, doesn't he? God loves people, and he loves them enough to put great medical care around them, health care around them. You know, we've got, you know, I just think my dad, you know, died earlier this year. I think we'll know about that. But what a beautiful ending he had to his life, surrounded by beautiful Christian worship and care. And I think, yeah, there's all sorts of things where God's grace is manifest in and through our lives and in the lives of those around us, just on such a regular basis.
Yeah, I mean, we're coming to, isn't it, that period of Advent? I think one of them is love, is the last aspect of what you celebrate. I think we talked about a couple of weeks ago, sort of celebrating Advent for the first time in a particular way, and everything. There is opportunity for love to be demonstrated in our workplaces in multitudes of ways. But I say you may not know the impact of it, and just I think part of me is just trust that you're walking in that. You know, just trust that you are walking in love, and yeah.
I think also we have to remember overcoming the tougher times actually that happens around, well, throughout at Christmas time, because people are not always in their best place in and around Christmas. You know, people are like thrust together, but sometimes it doesn't bring the best out of them. And I was saying to you, without going into details, one of my years is working as a partner in general practice, and we did our own on-calls at that stage, you know, nights and weekends. And I was on duty overnight on Christmas Eve, going into Christmas morning, and I got called basically, and quite an abusive call just before midnight. Abusive and threatening call, so I had to go out and visit this person at home. I needed to take a police escort with me for my safety, so I actually called in at the police station. I think it was just before midnight on Christmas Eve, and said, "Look, hey guys, I'm Dr. Carter." They knew us, we worked well together. I said, "Dr. Carter, I'm on call. I need your help, please. Would you come with me? Because this could be a threatening, nasty situation." So that was my first thing that I did. First thing, about 2 minutes past midnight on Christmas Day, was, well, happy Christmas. Here I am, the doctor with a police escort, and it got sorted out. But there is stuff that goes on that's less pleasant, and we just want to recognise that as well. Sometimes it's not. No, there are stuff, and the people are working in some tough units where there will be tough things going on. So well done, everybody. And then we're looking into the new year as well, aren't we, Sasha? 2021 is on its way.
Yeah, I mean, you were talking last week actually with Liz about spring and the shoots, and there's something that's been sort of I've been thinking about actually in the last couple of days. There's some situations going on with regards to people that we know in their health, and I mean, I personally have a very close friend who is in a London hospital on ECMO at the moment. Husband has a husband, three children, one of whom is at their birthday today. And here's what I've been thinking about. How do we know the fruit, or what do we know about the fruit of the season that we've been in? And I was reflecting back on what you were talking about last week with these green shoots. And in this situation, what I'm seeing are the green shoots of the unity and that sense of rest, in the sense of, at the moment, we are praying into a few situations in regards to people that we love and care for, a part of family. But there is no sense of striving in it. And looking at what's been created over the last number of months, I mean, particularly I'm involved with the Healing Centre team at Eastgate, and the sense of unity, cohesion, and that sense of rest, and that we're fighting from a place, or not even fighting, we're coming from a place of heaven towards earth. For me, looking ahead into the new year, that's really exciting, because that sort of exponential increase in growth, and there's the word unprecedented has been talked about and mentioned, and interestingly, not just in Christian circles, actually, the word unprecedented I keep on hearing it. And so for me, I'm looking ahead, starting to see these green shoots of the effects of rest, when we're actually fighting. You use that word fighting. I'm so used to using that word in the past. It feels like there's a change of language when it comes to how we approach situations. And so looking ahead into the new year, that's been really, really, really encouraging. It's exciting to me, and the different opportunities and things that absolutely undoubtedly will start to appear. Again, Liz last week was saying about some of the things that she's been working on that will start to become apparent, and that's really exciting too for me. Yes.
Yeah, I think we're all looking forward. It's one of those things, and you get into the end of 2020, and I think most people will be happy to see the end of it. I'm not saying that in a strange way or dramatic way, because it's been a tough year. I don't think anybody can say no. It's been challenging. So this year will pass. Mm. We'll look back upon it, but I hope we'll look back upon it as a great learning experience and lots of good stuff being done together. A lot of communal spirit that's come through. Hopefully, as Christians, we've been strengthened because God has been with us through this. And whenever you go through tough times with God, you come out stronger. God's prepared us. I honestly believe that for the coming year. We've got some really exciting things that we're working on for Heaven in Healthcare. Do you just want to flag up anything that you've got coming up in the new year, Sasha? Because you've been working hard behind the scenes, haven't you? Is it okay to broadcast it?
Yeah, that's fine. Yeah, we've got Heaven in Healthcare. I've got a series around the subject of dreaming. That's not your nighttime dreams, but it's around the subject of your desires of your heart and dreaming with God. But dreaming with God for healthcare. And one of the things is, at this moment in time, it might not actually be something that is hot on someone's agenda, with everything else that's going on, but actually it's the best time to start. So starting in January the 8th, on a Friday evening, we have Janine Mason, who is going to start with the journey, and she's written a book. I wrote the book Dreaming with God, and has a great journey in regards to dreaming. I won't go into all the details, but and then after that, every other week until March, we hopefully have 6 sessions lined up, just waiting to confirm the last one, but regular sessions. And what we wanted to do with this was to make it easily accessible, because we're working in a healthcare world, to commit to 6 sessions and feel, oh, if I can't do this one, then I might miss out on that one. Each session is standalone. Each session is unique to the person that's bringing their take on dreaming. So each and every one of them you could watch and get a lot from. And then what we're doing is we're collaborating with Dream Revolution, the Dream Revolution app, with Jamie and Rachel Lee. And we're going to have the sessions on the app as well, so that you can actually then access them. So you can complete the journey. And there's some other resources there that can help you around dream coaching. So we're trying to put something together that at this time, it is the time to dream. And actually resurrect some of the dreams and desires that you have. And hopefully this is a way that we can help do that for you. That's kind of the way we're looking.
That starts on 8th of January, does it?
Yeah, the email, the invitation, the email will be going out on this Friday.
And how do people sign up for that?
So email, have all the details, and literally it's a case of the Zoom link will be on there. And it's sent out to Heaven in Healthcare. And then it's a case of, you can tell other people that you think would benefit. And
if people were watching this who aren't part of that email distribution list, how would they get hold of it?
So if you go to inquiries@heaveninhealthcare.com, or you can go to the Heaven in Healthcare website and you can sign up on the website as well. But if you go to Heaven in Healthcare, inquiries@heaveninhealthcare.com, I think that's the best way to do it. And because of GDPR, we still have to have your permission to send emails. So yeah.
Yeah, and just to say, we're refreshing the website. We're in the process of doing that, so that'll get a fresh look in the new year. So Phil is with us; he's working on that. So we're going to make the landing page a bit different. So anyway, that's good. Then we've got other stuff. I'm just starting to think around getting a date in the diary for a conference, Heaven in Healthcare conference at Eastgate later on in 2021, and start to meet together in person and build local groups, which we want to do. And if you're interested in actually getting established with local groups, then again, get in touch with Heaven in Healthcare, put through inquiries. And actually, I was looking at doing some Zoom connection times as well, actually, in the first few months of the year, because I think basically through till Easter, most of it's going to be online still, and then hopefully we'll be in person. But we want to give you plenty of stuff that can help you connect with us. We've got a lot of things going on that we've been thinking about, again, working behind the scenes, and So yeah, we're looking forward to 2021 as we move forward with Heaven in Healthcare, aren't we?
Yeah, most definitely. It's exciting. I use the word exciting a lot, but I genuinely am excited about that. But it's exciting because all things work for the good.
Yeah.
And nothing, you know, in the background, our hearts, our minds have been ticking over right all the time, haven't they? And it's just, yep, there's stuff coming, and it's going to be good.
So, and I wanted to say to you, Sasha, it's been a great pleasure working with you throughout this year, and Phil as well, and others who've taken part in real life. Many others, you know, going back to early days, we had Comedy helped us out with hosting, and Liz Lunt, Mike. There've been all sorts of people on here. My own son, Dave Carter, and hopefully we've served people well. We've been getting good feedback on this, so that's good. And so, Sasha, I want to celebrate you and Phil as well, and they're in the background. And we want to say we celebrate all the work in the world of healthcare, particularly at Christmas time, and recognise the part that you play in making our nation as healthy as it possibly can be. And as we've moved forward into 2021, it's our desire at Heaven in Healthcare to support you, encourage you, and give you resources which you can tap into, like we just talked about with that dreaming with God, really, isn't it? So
yeah, no, absolutely. I just want to say a Merry Christmas to everybody. It is interesting, actually. Here's the thing: that 2021 is going to be full of hope, and we get to be architects of hope in that season. And I was doing a bit on hope, and I looked up the word architect, and it means the chief builder. And the example given in the Cambridge Dictionary was of Nye Bevan, who was the architect of the NHS. So that is so powerful. We get to be architects of hope as we go into 2021. So a very, 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 very happy and merry and prosperous Christmas.
What a great way to sign off, and we'll look forward to seeing you. We have got one other episode lined up for actually the week between Christmas and the New Year with Annie, our great friend, and that's a lot of fun, isn't it? Sasha, you had an interview with her, and so we pre-recorded that, so that'll be a bit of fun to release just after Christmas, we hope.
Absolutely, it is full of hope and it's full of joy. Honestly, I would say jot it down on your diary. It's well worth the watch. It's
we should be broadcasting that. I think it's something like what will it be? 25th,
30th, I think.
30th of going out on the Wednesday after Christmas. Anyway, that'll be out on in real life on Facebook, and then landing on the Heaven in Healthcare YouTube channel. Yeah. So we wish you a Merry Christmas, and we look forward to a fantastic 2021 where we will help to move the world forward together.